warm welcome to my dear patients and their families, and for giving life to this book. You have taught me more than what I read during my post-graduation to do oncology. You have given life to this book, and I have learned treating you more than what I learned in my life. Thank you very, very much for being part of my journey, and I sincerely acknowledge through my bottom of my heart. My warmest welcome to Mr. Akulpreet, the most popular and sought after actress in the Tollywood, and of course she's getting into the Bollywood as well. All the very best, and for the new movie which is going to come up in 1 month or two. Thank you very much for being with us in most of our cancer awareness programs. Thank you very much. And simple thanks will not be sufficient for Ms. Sangeeta Reddy, Executive Director, Apollo Hospitals. She has been my source of encouragement, and she's always been encouraging throughout my career for the last 3 decades. Thank you very much, madam. Thank you, Venkatapati Raju Garu, for gracing the occasion and joining us on this endeavor. Thanks a lot, and we would continue to trouble you in the future too. And a sincere thanks and warm welcome to Raghuram Raju Garu, that just out of the blue, he just came to my office once and he said, Dr. Garu, we have to do something on this. Majority of our patients, they belong to Telugu states, so we should do something on it. And he has taken that initiative and converting it into a wonderful Telugu version. In no time, in just 3 months' time, he did that job. And thanks a lot, Raghuram Raju Garu, and thank you very much, Vijay Garu, for taking up this job and making it accessible to the public. And I'm sure it's going to go a long, long way in our Telugu states, and it's going to be of great help to our patients. And thank you, Chandrasekhar Garu, for doing such a wonderful translation in Telugu. I was a little worried whether this can be really translated. What comes out from the patient's heart should be really translated properly so that it should be easily understandable for another person who is reading it. Now, how important is this? If I recall some of my patients, one lady at the age of 32 comes to my clinic and says, Dr. Garu, I am diagnosed of cancer and I have 2 small kids, 8 ఏళ్ళు 11 ఏళ్ళు అమ్మాయిలు ఉన్నారు. నేను బతకాలి, నేను ఈ అమ్మాయిల్ని నేను చూసుకోవాలి, there is nobody to take care of these kids. And she kept on weeping. It's the word that diagnosis of cancer only means death. And that lady is now surviving happily. Both the daughters got educated, married, పిల్లలు అయిపోయారు, వాళ్ళ పిల్లలు కూడా అయ్యారు. Now she is a granny. There's one young boy who had come from United States who did his MS in engineering, complete chesi. Suddenly he had a headache and he had come and he was diagnosed of a tumor in the brain, and he had come to India. And he says, Dr. Garu, I have only mother and I don't have father, I have to take care of my mother. There's nobody else. I have to leave at any cost. And trust me, and is completely out of the disease and is doing a normal life, and he took his wife to United States after the treatment is done. An young lady, software engineer, comes to my office and says, Dr. Garu, I wanted to commit suicide yesterday. Why the hell I should go through this horrifying treatment experience? వాంతులు అవడము, ఎంటికలు ఊడిపోవడము, విపరీతమైన బాధలు చూశాను నేను పేషెంట్స్ని. అంతా అయిన తర్వాత కూడా ఎట్లాగో చనిపోతారు. వాట్ ఇస్ ద పాయింట్ ఇన్ గెటింగ్ ద ట్రీట్మెంట్ డన్? సో ఐ బెటర్ నాట్ గో ఫర్ ద ట్రీట్మెంట్. అండ్ దాట్ లేడీ continues to work in the software company, got back her hair, pretty young lady, and she brought another 12 patients to my office after the treatment is done, and she is happily living. There are several such stories which I'm sure all of you might have experienced. The fear of diagnosis, cancer diagnosis, and symptoms రాగానే క్యాన్సర్ ఏమో అని భయపడి దాని దగ్గరికి అసలు ఇన్వెస్టిగేషన్స్ కూడా పోకుండా పారిపోతుంటారు. డయాగ్నోజ్ అయిపోయిన తర్వాత ట్రీట్మెంట్ ఎందుకు, ఈ కర్మ నాకు వద్దు ఎట్లాగో చచ్చిపోతాను, ట్రీట్మెంటే వద్దు అని పారిపోతారు. ట్రీట్మెంట్ అయిన తర్వాత కూడా ఎవ్రీ మంత్, ఎవ్రీ 3 months when they come for the follow-up, I remember patients coming to me 3 నెలల అయిన తర్వాత రండమ్మా అంటే ఫస్ట్ స్టెప్ నా రూమ్లోకి వచ్చే ముందు వాళ్ళకున్న భయము, ఆందోళన, ఐ కాంట్ టెల్ యూ హౌ మచ్ దే ఆర్ సో స్కేర్డ్. డాక్టర్ గారు ఏం చెప్తారో 3 నెలలు అయిపోయింది, నా జబ్బు తిరగబడ్డదేమో అన్న భయము ఈజ్ ఆల్ ద టైమ్ దేర్ ఇన్ దేర్ మైండ్ అండ్ సోల్. Even after the 5 years, 10 years, they still have that fear the disease might come back. And so many people who come and meet me tell me, sir, డాక్టర్ గారు క్యాన్సర్ వచ్చిన తర్వాత ఏదో టెంపరీ రిలీఫ్ కానీ పూర్తిగా పోతుందని నమ్మకం లేదు, తప్పకుండా మళ్ళీ తిరగబడుతుంది కదా అని కాన్ఫిడెంట్గా చెప్తారు. So to eliminate those kind of thoughts and fears in your mind, honestly, scientifically, today 2/3 of the cancers are getting cured, which it's very hard for the people to believe. విజయ్ కుమార్ గారు మాట అన్నారు, సినిమాల్లో ఒక క్లయింట్ని చంపాలి అంటే వాడికి క్యాన్సర్ అని డయాగ్నోస్ మొదలు పెట్టడమే. ఇట్స్ సో అన్ఫార్చునేట్. టుడే 6 out of 10 patients, 65% of the patients would get cured of the disease. So you just have to be positive. Best way to come and see if you have some symptoms, some doubtful symptoms, go and get investigated, get diagnosed and get treated. You will be out of it and you will live a normal life. You see so many people coming here, so many people who have written stories world over. We have compiled them into only 108. Sangeeta was so much interested in that number of 108. We had already had 156 patients, but we condensed them into 108, the best possible stories which anybody, anywhere in the world can relate themselves to any of these patients in this book, from head to toe. You have brain cancer, lung cancer, food pipe cancer, oral cancer. They can relate that, okay, this patient had this problem, what all problems that he faced going through the journey of treatment and how they are living their life now. So when a doctor tells a patient, anta baaguntundi, don't worry, the patient hard for him to believe that. So when it comes from a patient's perspective, his own story being shared, then it works wonders. So keeping that in mind, we thought we'll combine them into a book, and this is the only book in the world to have so many stories, more than 100 stories of various kinds of cancers. So that is what is our idea and goal, to get this compiled into a book, and fortunately it turned out to be the best book in the world, and the maximum number of sales were done, and we translated that into Telugu for our own people in this part of the world. And finally, join me in saying, cancer is devastating, but what cancer cannot do? It cannot cripple love, it cannot shatter hope, it cannot corrode faith, it cannot silence courage, it cannot invade the soul, it cannot steal eternal love, it cannot conquer the spirit. Say it loud, I am a survivor. Nenu cancer ni jeyinchanu. Thank you very, very much.